When we're thinking about whether or not to do a knee replacement on a patient, that knee really has to be bad enough, as we've chatted about beforehand, that they need to have night pain, limited walking, maximize their painkillers. Now, if only one knee is that bad and the other knee is sore but not bad enough on its own to justify an operation, in that situation I would not recommend having both knees done at the same time. However, if both knees are just as bad as each other, then having both knees done at the same time, if you're medically well enough, is far better, because the accumulated complication rate of 2 anesthetics is greater than the risk of having one anesthetic for both knees. The downtime after the operation, you rehabilitate the same for 2 knees as you do for one knee, and it means you don't have to have 2 separate rehab processes. But the interesting thing about it is, if the person has one bad knee and one not so bad knee, when you operate on that bad knee, many times the other knee actually gets better, because it's been taking so much extra load because of the bad knee. When the bad knee now becomes the good knee, the other knee doesn't require surgery for often 2, 3, 5 years. So my decision making is, if both knees are equally bad and on their own each would justify surgery, I'm very happy to do a bilateral simultaneous total knee replacement. But if they're not independently bad enough, I would not recommend both be done at the same time.